Hello, everyone, and welcome to Softfield Academy's live masterclass. We are very happy to welcome everyone. Welcome first to Dr. Francesco Marchetti. We are very happy to do this first webinar. It's your first webinar with Softfield Academy, so we are very glad to welcome you and also to welcome you as part of the Softfield Academy family.
Thank you. I'm really honored and more than happy to join the Academy, to join the Softfield family, and let's see what's next.
Great. So tonight's webinar is being recorded and it will be on Softfield Academy's platform from tomorrow. It will also be on our YouTube page, so don't worry if you miss any parts. It will be live from tomorrow. You can rewatch it as much as you want. Can you go to the next slide, please? So tonight's theme is the body injections using cannulas. As you know, Softfield developed a new range of cannulas, especially for body injections. So tonight, Dr. Marchetti is going to deal especially with three zones: the buttocks, the hands, and the calves. Dr. Francesco Marchetti is a plastic and reconstructive surgeon from Italy. He works especially in Rome, Milan, and in Doha in Qatar. So I will now let Dr. Marchetti start the webinar. Please wait until the end of the webinar for all of your questions. You can ask anything during the webinar in the chat part or the Q&R part, but we will answer everything at the end of the presentation. Thank you so much. I hope you will learn a lot tonight, and we will talk more at the end of the webinar.
Thank you, Anna, for your amazing presentation and your amazing welcome. I'm really happy to start this new webinar. For me, it's the first time, but we will talk about something I used to talk for maybe 10 years, maybe between 8 and 10 years. This is a really a new option for the face, but cannulas will always be the best option for if we are talking about body treatments. Cannulas could be not only for fillers, could be also when we injected the fat, and Softfield cannula could be really the best option also if we are injecting the fat. For sure, we have to differ between, as we see in the slide, between the cannula and the needle. Needle, if we are talking about body, is really not the best option. Why? Because of the sharp and the tip that sometimes if we are injecting, for example, in the buttock, we could not be so safe because we can inject inside the muscle, and injecting inside the muscle as regarding the fat, we know that the FDA stopped to inject, to suggest injecting in the fat because of the microembolism. That's the same with the hyaluronic acid. So cannula could be, above all for the blunted tip and therefore for the flexibility, amazing and safer. We just need one entry point with the cannula. Usually, if we are talking about buttock, we share with colleagues our technique of tridimensional, so we can decide to inject between 2 and 3 entry points, but it's not for sure the multiple entry points that we could need with a needle. The range of cannula, we know it's really, really wide, but as regard the body range, we can focus on 2 or 3 points. That is the 16G, the 18G, and the 20G. If we are talking about ends, we can use between the 18G and the 20G. What differ really from the other part of the body is that we can choose a smaller length, because we can choose the 70 millimeters instead of calves and buttock, or sometimes also some body defects in contouring or like post-lipo defects. We suggest to use longer cannula, like the 90G cannula, because it's still not so much flexible, so you can reach also the farthest point with the same accuracy and with the same safety. The range of the cannula fits really for every zone and for every filler type. We are talking here about fillers that usually is hyaluronic acid, but we can also use this kind of cannulas also for the polylactic, just around the body. It's really big also, the diversity, as I told you before. And above all, also the design is to give to us as a doctor the more safety that you can. The tip is really rounded, so it's really safe because we don't risk to inject, at least in any vessel. The area that we are treating when we are treating the body is quite safe. If we are talking about the buttock, it's really, really difficult to inject inside some vessel, because we have not any big vessel in the soft tissue layer. That is, the deep soft tissue is the tissue where we have to inject when we inject the buttock. And also the graduated design, more precision when we decide how far we are going to inject. Today's the cannula are sold in usually in boxes with 20 cannulas with pre-roll needles that are really designed to fit with the cannula we are using. For the body, as I told you, this is the range that we use. Sometimes, and someone could use also the 14G. I use the 14G for the fat, not for the fillers or for light treatment, because usually sometimes 14G could be really a little bit too wide. It's really important for the body filler because of the thickness of the body filler, the luer lock base, because the body filler sometimes could have a bit of strain when we inject, but with the luer lock base we are super safe that we can inject, to avoiding the resistance and avoiding to spread the product out of our injection and between the syringe and the cannula. Usually here we have a slide where we summarize which is the best cannula we are injecting. We are now doing with Bioscience a new study on the feet, so we will use also on maybe the 23 or the 20 with a softer filler. The tissue depth and above all the quality of the tissue is really important while we are injecting inside the body, because the layer that we have to reach, it's always adipose tissues. Also, when we inject in the end, that we know that we don't have any big adipose tissues, is always deep subdermal. It's really, really important. We are talking always over the muscular fascia. The injection is always over the muscular fascia. The cannula for body contouring is really useful for the volume enhancing, for skin remodeling, if we are talking about cellulite sometimes, and also for skin laxity. That usually is done like a second or third step or treatment when we are volumizing or reshaping in buttock, calves, concavities. We can treat, and this kind of cannula is really super have an high performance, above all also for scars, where we see that also with hyaluronic acid, we could have really an amazing improvement while injecting for the biostimulation of the hyaluronic acid. Today, we assist really an increase in the number of requests of the body enlargement because we have this new tool that are fillers, because in the past, we know that we have just two options, that is the surgery and the sometimes the fat. Between this option, the body filler and above all the HA is really different because it's an office procedure. We don't need to use a big quantity or big amount of anesthesia. It's for sure really less invasive than surgery. And maybe if we are talking about the possible complication that we could have with implants, we can say that it's also safer than surgery. For sure, the difference between surgery and injection in aesthetic medicine is the smaller learning curve, because if we are talking about implants in buttock or implants in the calves, is one of the most difficult area to treat with implants, and usually surgeon requires really an extensive experience, while we are starting to do by ourselves this kind of peculiar surgery. Is not we're talking about the HA, we are talking about the filler, so we are talking about something non-permanent that is also this really safer. The recovery is super fast, as we will see later. We will have a really minor downtime if we are compared to surgery, with minor touch-up. We will have between calves and buttock different need of touch-up. The touch-up, the most important number of touch-up usually is when we are talking about buttock. But in calves and hands, usually we could have just a little or a light touch-up after a month. As I told you, this is the difference between the filler and surgery. What I want to underline is that the learning curve is really, really less high than what we have in the surgery. Yeah, if we compare the cost ratio between the cost and benefits, maybe filler could be a little bit higher, but with the new kind of filler, especially the HA, we are talking about macromolecules instead of micromolecules that we use for the face. We have a really long-lasting result that could last at least up to 2 years. The HA benefits, as I told you before, is between all these characteristics is I want to underline the fast healing. So we are talking about the minimal trauma, and the minimal trauma is really linked also to the use of the cannulas, because instead of multiple entry point with the needle and instead of the sharp tip, with the blunt tip we don't have, because we arrive really very easily with the needle for the entry point. With the cannula, we arrive really easy in the safe and in the precise layer that we have to inject. So the trauma between, swelling and bruising will be really, really reduced. This is a repeatable procedure. You will see, and you will adjust the volume and the reshaping as long as the patient and the doctor desire. And also hyaluronic acid could give us a moisturizing effect. The technique is really important, so it's really linked to, for sure, the skills of the doctor, but a lot also on the tool we will choose. If we choose this kind of cannulas, we could be really sure that we will avoid also a fast resorption, and above all, the side effect that usually body filler could have if we don't have the right tool to inject and the right technique. This is the big difference that I told you before between the hyaluronic acid for the face and hyaluronic acid for the body. That's why we need to use bigger cannulas. Sometimes doctor after the trainings ask me if they can use cannulas like 23 or 24. I think that it is really too hard to inject macromolecules into a 23 or a smaller cannula because the particles are really larger, as you see in the slide. That means that we could have more resistance to hyaluronidase. That is really important for us due to the volume, but the volume is bigger. So also injecting in a smaller cannula could be really hard and also could give us a worse effect. It's really important not to inject with bigger cannulas, because if we have this facility to inject, we could increase the risk of lumps and big nodules that it's really hard then to dissolve. The thixotropic technology that the filler I use, it's really peculiar. It's linked to the facility and to the easy of injection, because while we are going with the force into the cannula is designed to take the hyaluronic acid that at time it enter in the cannula, it becomes smoother and really homogeneous. As soon as the hyaluronic acid leave the cannula, it come back to its normal stability. So we have the possibility with this thixotropic technology to have a safer hyaluronic, a safer injection, an easier injection, and also because it turns to a stable form as it comes in the tissue, also more durable. Usually body filler could be divided in body filler, in softer body filler that is for reshaping, and in volumizing body filler that is a little bit thicker. The big difference is the particle size of the HA. One important thing is that sometimes we use for sure biphasic body fillers that give us two big opportunities to have a really long duration and a really safer stabilization in the tissue. But we need to inject deep in the dermis, because if we have some problem, as I showed just one picture to be really wide in our talk tonight, is that if we inject too superficial, and sometimes if you are not accurate when you're injecting with the cannula, you could have problem because you are injecting too superficial, and the hyaluronic acid in the stabilization could give some lumps. So our mission as doctor and as injectors is to have the right approach with the correct technique and the best products. The best products means good products and good tool to inject the product, that is the cannula that we showed at the beginning of our treatment. If we are talking about buttock indication, we have to know that fillers are not recommended for all the patients. We need to know that there's some contraindication that include the laxity of the skin when it's too severe, a poor tissue coverage, and if we are in front of severe ptosis, where usually it's better to inject with fat because we need a big amount, and we know that fat is not so linked to inflammation like the hyaluronic acid, or we need to treat with implants, and then maybe really accurately we can inject with cannulas just to redefine around the implant. This kind of cannula that Softil produce and develop, it's also really safe while we are injecting into areas where we could have some implants, because the tip is really blunt, and also if it touches a little bit the implants, you need to be really too strong to break the implant. These are the buttock area that we can inject with the cannulas. We could have a completely flat case. We could have a case that need to lift, so we have to fill in the upper areas, or we have to reshape. So we have to lift in the third case on the lateral part. Sometimes we need to inject also in the inner medial area of the buttock. One suggestion is to use, in that case, the 18G cannulas, because it's smaller than the 16G, so means also maybe little that the pain could be smaller. And this, the inner medial part, is usually the most painful area, so maybe also using a 70 millimeters instead of 90 could be the best. The last part is the lower part. As I told you before, in the lower bearing area, it's really contraindicated to inject. We don't need, we are not talking about a good product to inject or a good tool to inject. This area is not to inject. Why? Because we just increase the skin, the laxity and the ptosis of the gluteal area. When we do the assessment, it's really important, both for the product we inject, both for the cannula to use. We will have the stretch test and the pinch test just to measure the skin laxity and the skin coverage. This is really important also if we are talking about the right cannula to choose, because if we have a good coverage, we could easily use also a 16 gauge. Otherwise, if we have really not this amazing coverage, or there's a big laxity, usually we could try to go with maybe a smaller cannula like the 18G, or we are talking about for sure for cannula, for buttock and for calves. We could also try to use in really super skinny patient also the 20 if we want. The treatment protocol is to really do an amazing disinfection of all the area we injected. We use the 18G sharp needle that we have in the pack, in the box with the cannula. Then we inject with the 18G cannula. In the buttocks, I really suggest to inject with both in the buttock and in the calves with the 90 millimeters. I don't suggest you to inject with the 14G because usually the suture is needed at the end, because the risk of migration from the incision could be higher. Also because we have to massage, and in the massage we could spread the product out if the entry point is too big. And because, as I told you before, the high quantity of product injected could, in no-skilled hand, make too much lump. Post-treatment indication, thanks to cannulas, could be quite easier, and also the recovery could be also fast, because you have just to give attention to the gym, so physical activity, strong physical activity, avoid spa for 7 to 10 days. And if we are using cannula instead of needles, usually painkillers are really not necessary. Here is one videos where I show you how it's easy to inject with the 16G. In this case, we are injecting with the 18G. Sorry, we do the entry point. We lock with the lower lock base the cannula to our filler. You can see usually the filler is a bigger syringe than the face filler, where we are injecting 10 cc each syringe. You can see how easy the cannula goes inside. We do the entry point just perpendicular to be in the safer plane, that is, as I told you before, the deep fat just above from the muscular fascia. You see how it's easy when you are in the right layer to go up and down to inject all the area we drew before. We are injecting in the upper part, just to give the lifting effect. Usually, I always suggest not to inject not to came out at the end of the first syringes or between the syringes. It's really really better to stay with the cannula inside, so we avoid to try to reaching the contamination if we are going in and out too many times. Here you could see a 16 gauge cannula. You could see how deep we are. You would see also all the little tags just to know how far we go, and especially in the technique that has to be a fanning retrograde technique, that it's really easy if we use this kind of cannula. You see also if we have a lot of septae and a lot of fibers, the cannula easily go through this kind of difficulties. Usually we check every time we are injecting between the two sides. We could also use this kind of tools to reach easily also the most rounded part. Here you will have some before and after of injecting Bartox more than 5 to 10 syringe per side. Here is a multi-step treatment. This is really a tall model where we need to inject a huge quantity, talking about HA. So I divide in 4 steps the treatment, divided between each treatment, usually 1 month, 1.5 months, to reach this amazing result that is stable also more than 2 years. Because if you inject in different steps, you will increase the volume, but you will increase also the length of the treatment. Here is one before and after of really a small buttock, just to lift a little bit and reshape. We use at least in the hip dip and just in the upper area 4 vial per side. The transitory effect that we will have, also if we are injecting in the safe area with the best technique, with the amazing tool that Softfill give us, it's always bruising and a little bit of swelling. Sometimes we could have a little bit of local inflammation. Pain is not so common, but you could have itching in the first 3 days. All this transitory effect should resolve in a few days, at least between 3 and 5. Talking about the side effect, this is a bad result because also with a good product and good tools like the 18G Softfill cannula. And I show you why. Here you could see the big difference between the left side injected in the right way. We are down just above in the just above the muscular fascia, down to the scalpa fascia. In fact, in this side, the patient didn't have any problem. In the other side, you see how you have not to inject. There, the calage was too superficial. So the hyaluronic acid creates some lumps that the patient need to be diluted with the hyaluronidase. Shifting to calf indication, we all know the calf's anatomy. We usually, when we are treating the calves, patients are asking to enlarge the body of the muscle. I don't suggest you also, if patients sometimes ask to inject in the tendon, because you have to be really skilled for that part. Sometimes it's, you could inject just if you have to define, like it could happen in the arm for the deltoid area. The right candidate for fillers injection is patient with not developed muscle, with congenital small calves, or patient who had calves, not the muscle in the calves, not responsive to targeted exercises. The exclusion criteria here is for sure skin laxity and the poor tissue coverage. But if we are talking about patients with diabetes, great tendency to infection, or above all, vascular disease and previous treatment with permanent fillers, you have to discharge this kind of patient. Try really not to treat it because you avoid a big problem in the future. The treatment protocol is quite the same we use for the buttock. We can choose in skinny patient to use maybe smaller cannulas. We could try to use also the 20 one, the 20 the 20G cannula. I always suggest the 90 millimeters. In this case, we are using a software filler, the one we use for the reshaping. So it's also easier for a smaller end to inject with a smaller cannula, not smaller than 20, in my opinion. The side effect is quite the same that we have when we are injecting in the buttock. These are the tests that we need. The pinch test, and then we go with the filling. Usually we use the 18G blunt cannula. With the top of our fingers, we have to feel and check always where we are with the tip. We feel the lateral compartment, we feel the medial compartment. Here it's really safe to check the tip because we avoid to go inside the popliteal crest. That is really important. Sometimes we could choose also an upper medium entry point. This is for expert doctor, in my opinion, because they're in the popliteal fossa. If you are not in the right loyer, you could find some vessel that could give us problem. So as you will see here in the video, it's better to inject by 1 or 2 entry point from a lower injection point, because it's easier, it's safer. You could really be just if you go with the needle to do the entry point just perpendicular in the right plane. For sure, the layer here is thinner, so we have to avoid to go really deep, otherwise we inject inside the muscle. But I underline one more time how easy it is with this kind of cannula to stay in the right plane, because of the blunt tip and the tip that is really round. It's really difficult to change the plane without any big force. So also maybe the patient could complain a little bit if we are touching the fascia, and by this suggestion you could not be in the really safer plane. Here you see how we inject inside the medial and the upper part, that usually is the most requested area, just to shape and to feel the calf. This is some before and after of calf's augmentation. Then we go the last but not the least, because we really have in our practice a high demand now of hands rejuvenation, because we are rejuvenating the face, we are rejuvenating the neck, sometimes we are reshaping the body, but really hands usually give us the real age of people, because we all know that the young aspect of the hands is hands with good skin quality, without flaccidity, without cutaneous pigmentation, and one of the most important thing is without superficial vein and tendon visible. All is possible because we have a good percentage of subcutaneous tissue. The subcutaneous tissue in the end is for sure thinner than calves and buttock. But if we saw and assess an elderly, and we saw that we can see situation like this, where the vein and tendons are really visible. We can notice how big is the deterioration of the skin quality and how big is the flaccidity of the skin. This all due because of a quite total absence of subcutaneous fat. Injecting with hyaluronic acid means also to rejuvenate the skin and to create a new subcutaneous tissue. The ideal patient is patient between 40 and 80 years old, patient that have bad skin quality, both for genetic, both because it's iatrogenic, or if we have in front of dermatologic disease, or in front of tissue defect that could come from deep burns, tumor resection, or traumas. The unfilling procedure, as we will see in the video, is injection with local anesthesia. Here, we will inject not only in the entry point, but also all around the area, just doing little bumps. And usually the point of entrance could be the medial one or the intermediate, just on the 1 centimeter above the wrist. We have to be sure not to inject or to do the entry point near the vein of the dorsal of the hand and the wrist, but it's really easy to find it. Usually, the end, this is really important, and I want to underline with you this stuff. After 24 hours, present always this situation: redness, a little swelling, and itching. This is the normal healing process when we are injecting the ends. Usually, after 15 days up to 30 days, we will see the complete healing. After the treatment, we don't have any redness, we don't have any pain, but we have the result of a new subcutaneous tissue that cover vein, tendons, and give us a better skin quality. So as I told you before, there's some post-op side effects that we could say complication, but we could talk about complication if we are more than 72 hours. Usually, both the swelling and the temporary paresthesia solve in just 3 days. Here we see how is the injection with local anesthesia. We inject in the entry point, we inject in the hand dorsal, and we inject also sometimes in the interdigital spaces, because it helps a lot to have a good pain control before the injection. We do the injection by the entry point. We have just 1 centimeter above the wrist. We inject in the interdigital spaces. The tip of the cannula also in this area that we see that is really thinner. The tip gives us the possibility to stretch the skin, avoiding to traumatize it, and also to stay between the vein in the best way, avoiding to inject inside because of the blunt tip with its amazing curve. Here you can see some before and after. I show you, this is just for aesthetic purpose. You see how we reach the result to cover the vein and tendons, to give a better skin quality, and to give the subcutaneous tissue layer with hyaluronic acid by stimulation. This is a trauma after a birth. We reconstructed with a skin expander, and you can see how we improve after the skin expander with 2 treatments of hyaluronic acid, the skin quality, and also how a cannula could be safe in a traumatized tissue, in an injured tissue. Here, a cannula, we use the 18G cannula. It's really, really mandatory also to have a good disinsertion of all the different fibers and all the different adherences that we could find in a retracted skin like the one in the burns. Last but not the least, we know that it's also useful for deformities and concavity that sometimes we, as a surgeon, but also the aesthetic physician, could find after a bad liposuction. This kind of cannulas could be really useful in do a good feeling, but also to do a good injection between the retraction and the small adherences that the post-operative situation after a lipo always shown. To summarize a little bit, we say that this minimally invasive procedure, also talking about the reshaping of the body, has a lot of advantage if we use the cannula. We are surely less invasive. We are using a single entry point or two entry point, but just to have a scaffold technique and to increase the possibility of an amazing result. Or we surely have less bruising because there's no bleeding in the dermis. Usually also find hematoma, it's really, really hard. Usually the hematoma could be linked to the strength of the use of the cannula. So if you are in the right layer and we go softly, just moving a little bit the cannula, also rotating the cannula, we arrive and we reach all the area we have to feel without any problem of big bruising or hematoma. Surely it's less painful because it's really due to the flexibility and around the tip. It's usually painless treatment. It's more accurate and more effective because we can reach a perfect control in the injection depth. We more often could control it also rising the tip of the cannula. If we are in the deep cutaneous tissue, we cannot see it. Maybe we cannot feel it. We can feel a little bit, but if we see the cannula pinching the skin, it's underlined that we are not in the right plane. It's really, and the biggest important thing, it's really more safe injecting with a cannula because we have a perfect balance between the flexibility and the rigidity, and we have a perfect balance of the between the depth and the direction of the injection. Thank you for your patience and for the attention, and I give back the word to Anna.
Thank you so much, Dr. Marchetti. This was really an incredible presentation. We already have some questions. Everyone, please don't hesitate. If you have any more questions, please ask them in the chat or in the Q&R part. So first question that we got, in which cases or zones would you use the 14J cannula?
In my practice, I really use in few cases. Sometimes when we are in front of thicker and of thicker skin, or in case of big and thicker dermis, 14G could be easier and less painful than a smaller cannula. But I suggest, if you are not in front of big dermis or thicker skin, to inject with the 16G or 18. In my opinion, they are the best.
All right. Thank you. So patients sometimes ask if it's possible to inject in the fingers. What do you think about that?
not suggest you to inject with cannula in the fingers because you are really at risk of heart, nerves, and maybe also vessels. That also, if we are in the dorso of the finger, it's better to use maybe a needle for a finger, in my opinion. And usually fillers are not so accurate, and it's better to use biostimulators in the fingers, because you could filler sometimes could be too thick, and you will have a lot of bump, and then you have to solve with the hyaluronidase. But with skin booster, it's better. It's the best way to inject the fingers.
Thank you. Which kind of filler do you use for the hands, and how many vials per hand?
The filler I use for the hands is HyalCorp MLF1. That is, in my opinion, the best choice, because you have a body filler, but it's softer, and you could inject really easily. At least I always suggest not to inject more than 5 cc. So if we are using a syringe of 10, we share between the two ends. The minimum is to inject 2.5, 3 cc, because we really need to inject to cover all the dorso. It's really important to massage at the end. Also, if you have some lumps and bumps, don't be afraid, just massage, because it's a body filler, but it's really moldable. Also, you can inject with, sometimes I inject also with Genefil Contour, but it's always a bioscience filler that is maybe a little bit more softer than the MLF1, and it's the right indication for this kind of filler.
All right, thank you. For Botox, can we use a 22J 70 millimeters cannula?
I don't suggest, because it's really hard to inject. It will be really stiff, and also you will not so precise in the injection. Also, if you have a grit end like mine, because mine is really big, and it's not the right cannula to inject, because it's too hard to inject. You will feel really tired, and if you think that in the buttock, at least you have to inject a minimum, usually up minimum between 8 and 10 vials. It's really hard to inject with this kind of cannula. I think that Softfield developed the best cannula in the world, that is the range between 20 and 16. If you try it, you could never get back, because it's the flexibility is amazing, and also the control that you have while you are injecting. It makes really the difference.
Is moderate grades of varicose veins a contraindication to calves fillers?
Moderate couldn't be a contraindication. It's better always to check with an ultrasound before, maybe, if you see and if it is visible. But in the moderate cases, the cannula could be a good option, because you won't eat and you won't hurt any vessel because of the blunt tip. With an important or severe deficiency or vascular disease, it could be more difficult, because we are talking about different vessels in different layer. So if you avoid to take one, maybe you are the other one. So with the severe vascular disease, I really don't suggest to inject.
All right. Thank you so much, Dr. Marchetti. I think we are done. We don't have any more questions. You answered everything, and everything was extremely clear. Thank you so much again. Everyone is sending their thank yous and how much they loved it. So we are looking forward to seeing all of you again in our next webinars. Thank you again, Dr. Marchetti, and have a great evening. Don't forget to connect to Softfield Academy's page to watch the replay whenever you want. It will also be available on YouTube from starting tomorrow. So have a nice evening, everyone. Thank you.
Nice evening, you too. Ciao, ciao.
Bye.